Good evening and welcome to the June edit of Sabr. I'm delighted to have Dr. Nirali Patel with us this edit. We have Shaima also joining us from the Sabr Collaborative, and I'm Devi. Dr. Nirali Patel is somebody I met during a heritage walk. It's one of my most memorable parts of being in Bombay. I'm going to talk about Nirali briefly before we move into the conversation with her. So, Dr. Nirali Patel is an MD in radiology whose fascination with what lies beneath the surface extends beyond X rays to the city itself. Intrigued by the intersections of medicine, history, and art, she spends her time exploring Bombay's museums, galleries, archives, and forgotten corners in search of untold stories. Her curiosity about public health and the city's old battles with disease has led her to see Bombay as a living organism where traces of compassion, enterprise, and everyday life linger just beneath the dust of the present. This interest has evolved into a heritage walk that explores Bombay's medical history, as well as a shared breath, which is an oral history project on tuberculosis, which is undertaken in collaboration with the Citizens Archive of India. So, through these efforts, she hopes to encourage people to engage more deeply with the city through the lens of public health and discover the many ways in which medicine, society, and urban life have shaped one another over time. So thank you so much, Nirali. I mean, I was part of this heritage walk. One of the best things I could have done on a Sunday morning, on any morning for that matter. But for somebody who likes to think with public health, and for all of us who are thinking about care infrastructures, this was such a refreshing take on how one could see the city that one lives in. So thank you for the work that you do, and maybe we could just begin with hearing from you. That is, a little bit more of what you talk about in the bio, which is that you have an MD in radiology, and then you move into thinking about the city. So, yeah, thanks for
Uh,
joining us, and over to you.
but thank you again, Devi, for again, like I said, for inviting me to be a part of this conversation. And thank you for your, such kind words about the walk and that it was a very hot Sunday morning. So I'm really glad that you had a good time on the walk. Uh, but coming back to what you mentioned, how, the profession and how this walk kind of, just came to be. Um, just the journey of being a doctor is so long, right? To get to an MD, you're spending around 10 years of your most formative, years of your youth studying and being confined to the hospital, not really having, a lot of time to just go about and explore, just anything that excites or, a spark in you, or you want to, you know, um, if you're just somebody curious, it doesn't leave you much time and room to do that. So thankfully, after my MD was over, I graduated in 2018. It's been almost um, 6, 8 years since I've been practicing as a radiologist. Um, and post COVID, I finally got the time to, get out and about and explore Bombay, the city. And I've lived here all my life in Bombay. And I, I was like, I need to do something different. There's so much that is happening. And the city is not just, restaurant and food. That's not it, right? And I was fortunate enough to go on a couple of amazing heritage walks. Uh, and that sort of, and I met some incredible people. Big shout out to Alicia Sadikot, and she does some amazing heritage walks. And she kind of nudged me. She's like, Nirali, also, why don't you create a walk of your own? I said, really? Is that even possible? The only thing I've known all my life is, medicine. And that's the only thing I know. And she's like, yeah, of course. Why don't you think of something along those lines? And we I kind of attended a workshop, and the walk has been a result of the wonderful workshop. And it was just a result of me, digging deeper and just, being a curious person in the city. But then, since medicine is what I've known all my life, I chose to see the city, through that lens. So yeah, that was the journey of how I kind of created the walk.
Yeah, I mean, it's a super creative walk, right? I mean, gratuitous and contagious, that itself is just so, such a
Yeah.
hook, right? Like what is, and just starting, I still remember starting out with the Fort dispensary, gratuitous
Yeah.
dispensary, and all these little nuggets, that you've pulled out very
Yeah.
generously also for, everybody who's attending the walk. I just wanted to ask you, I mean, I realize there's a possibility of a workshop through which you processed this. But you've connected medicine, history, and art. You mentioned, right, in these
Yeah.
different ways. And I
Yeah.
was wondering that, how do you see them as related, but also maybe what is the, necessity that you saw that you feel like, you wanted to bring these into conversation.
Personally, the experience for me has been, in a way that it made me think differently about not just the city, but the times that we're living in, right?
Mm.
Um, so much of the present day context, you can make much, it makes so much more sense of
Mm.
your present day
Yeah.
circumstances by understanding a lot of the stories that happened in the past.
Yeah.
So history is not just, facts and stories, but there's so much that you can, understand and make sense of your present, if that makes sense at all. So for me, it was a way for me to kind of think outside the box, to think about things laterally, to kind of,
Yeah.
not just get stuck in a very pigeonhole way of
Yeah.
thinking. So it kind of really expanded my worldview.
Yeah.
And it was such a great experience. And I thought that, it would be such a lovely thing to share with, anybody and everybody who would be interested in such a thing. Initially, I thought that maybe I would, it would appeal to my fellow doctor friends, colleagues, whoever. But I mean, since the weather in Bombay is quite brutal,
Yeah.
and we have very few months where we can, walk in the city, and also Sunday mornings being one of the, few days that you can walk and explore the city. It was hard to get in the doctors, the one day they might want to rest, or the residents who might be on rounds early in the morning. So that was quite a challenge, but I hope that, I get even more doctors to come and experience this walk, because I'm very excited to share this version of um, medicine in the city with them.
No, I have so many follow-up questions on that, but I think I'm going to also park that question for Shaima because she's also been so curious about this question of, medicine and health and how that comes together, health humanities in so many ways. But
Yes.
but you keep talking about Bombay, right? Which I love, right? The idea of Bombay as this living organism, as a city that you've grown up in, and the way you engage with it. So I was wondering, are there uh, you know specific neighborhoods? So of course, I've been through this walk, but if you could share with the people who may be tuning into this video or as the podcast, in terms of how you started connecting these neighborhoods and their histories, or what specifically gets you excited. Mm.
To be honest, there was no particular, way, or no particular geography or a particular neighborhood that I kind of picked and read about. It was just, the thing is, it was a very abstract idea. Like, if I just rattled off, hey, I want to create a, walk in Bombay, but with a different theme, how do I do it? Like, the thought of it is so vague, so abstract, and, to create a walkable route where, you're tying in the story with what you're seeing in front of you. Um, it first seemed like a very daunting task, right? Like, history of Bombay is, especially when it comes to medicine and healthcare, like the the first hospital that we got was in 1845, the JJ Hospital and the Grand Medical College, right? Uh, the campus is, the old buildings still exist. It's a huge campus in the middle of the city, right? It would be ideal to do a walk over there, right? But that would make it a more hospital centric walk. And also, it's a government institute, so getting permission to do something like that would have just not been a very practical thing to do. So, and the way the walk got created was extremely, organic. It was just I had gone to see a art show at a lovely gallery slash museum called Sarmaya in Fort. And as I was exiting, I noticed the back part of the Parsi Lion Hospital. And I don't live in South Bombay, right? So for me to stumble upon a building which looks so old and in ruins, and I was immediately, I was like, oh my God, wow, what is this? And then I, like take a picture and I'm like, wow, this is very interesting. And it kind of stayed with me in my head. And then the entire area, the fort area, the esplanade part of it that we were walking in, it is just so lovely. It has amazing, huge trees and such lovely old buildings. And I thought to myself that if I want to talk about a topic like medicine, the first thing that people think is not a fun, interesting stories. It sounds like, oh, she going to talk about how many people died in this epidemic and that epidemic. So I thought to myself, if it's a topic like this, I don't want to do it in an area which kind of damps people's spirits, right? This is a great area to walk in. It's got great trees, lovely buildings. It'll be a nice way to balance, the theme and what makes just walking around. So this kind of stayed with me, and I didn't have any idea of the the buildings that were there or the stories that were hidden behind it. And one day last May, I told, there's a friend of mine, and I was like, I really want to explore this area, just walk by myself and just randomly take pictures, and then I'll go back and see if it's, if it has any historical context. So I did that exercise. And at the end of the walk, I noticed this very old looking, but this just it felt completely hidden, and that was the dispensary where we start our walk. And I really didn't give it much thought. It was lying there in one, in my phone gallery. And I'm like, at that time, I was like, oh, but St. George Hospital is so old and it will have a great history if I can walk, very far-fetched ideas. And thankfully for the workshop and the way Alicia has been so amazing. She just was just a great mentor through the whole thing. So she kind of, nudged me and told me that this is practical, this is not. And then the more I walked around the area, the more stories I kept, going back to and reading about. So that's how the geography, and because it's the most historic and one of the oldest parts of Bombay, it kind of helped that I could get a sequence of stories in that short walkable distance. So that was how, the walk came to be. But from the significance of history with respect to public health in Bombay, there are several others. The area where plague was discovered, which is Manvi, for example, and the other areas where, as the historians, called it the native towns, so where, people lived in much densely crowded areas and other things, which obviously would mean that the epidemics were much more common in those areas. So,
I was wondering if there is a specific I mean, I realize this is taking us to concrete parts of your walk, but you did mention that something that happened in the past, which is in the history of some of these spaces, often resonates with what we're living through today as well.
yeah,
And I was wondering if you could share with our listeners about any one of those nuggets,
yeah.
in terms of how, for example, there was segregation or people, the state's surveillance of some of those epidemics, any one of those which you think resonates with you or is important for you
No,
to
just a
convey.
very basic thing of the diseases. I mean, the diseases were one way through which the British introduced simple statistics, which are now a very important part of our lives. The most basic thing, a birth certificate and a death certificate. So these statistics were introduced because the British were dealing with, you know, all of these public health challenges, right? If I'm if I remember correctly, I'm not really sure if it was introduced in Calcutta first and then Bombay.
Okay.
Uh, but simple things like this, right? Because
Yeah.
they needed to make sure that, who was dying from what disease and how. And then there's
Yeah.
a whole process as to how they
Yeah.
came to the whole, way of recording the births and deaths,
Yeah.
right? So it's just so interesting that it just didn't happen overnight, right?
Yeah. Yeah.
So something as simple as that, and it makes me wonder that, oh wow, what a journey to get to something, you
Yeah.
know, um, something as important as a birth certificate and a death certificate.
Yeah.
And not just this, but in terms of diseases, something I've spoken to you about, tuberculosis,
Yeah.
right?
That was
That
going to be my next question, but
Yes.
if you want to,
No,
we
but
could,
but
yeah.
giving but even looking at what was happening in the past with respect to the disease, how everybody came together to battle the disease in Bombay specifically, versus what is happening right now, because it clearly wasn't a problem that went away. We're still dealing with it. And the way I look at it is there something that we can learn from what they did to deal with it? Of course, things have changed. We've got great diagnosis. We've got some amazing medication. But along with that, the disease has become so complicated. It is evolving, right? We are evolving. The bacteria is evolving. It's becoming resistant to the drugs. It's no longer a simple lung TB that used to be a huge, like lung tuberculosis was a very, I want to say a huge percentage of the tuberculosis cases back in the day. And coming to 2026, TB, extrapulmonary TB, as we call
Yeah.
it, that is also becoming, the percentage of the extrapulmonary TB cases are increasing, the complexity of the cases are increasing.
Sure.
So, when I think of this disease, I find it so interesting to see what happened in the past and how they were dealing with it. Of
Sure.
course, it was more challenging for them because they barely had any tools in the arsenal, right? They
Yeah.
barely had any diagnostic capabilities except for X-rays.
Yeah.
Um, they didn't understand TB
Yeah.
as well as we do right now.
Yeah. Yeah.
Um, but for me, I find it incredible how every single
Yeah.
important individual in the city came together to be
Hmm.
part of that
Hmm.
anti-TB league, right?
Yeah. Yeah.
140 of the most prominent citizens of the city,
Hmm.
because it's such a grave problem,
Yeah.
and nobody could turn their backs around this
Yeah.
problem.
Yeah.
The BMC, the government, the prominent doctors, the industrialists, the mill owners,
Yeah.
everybody, right? And so, it was so interesting to read that, right? Like,
Yeah.
um, it was a public effort as much as it was a government effort.
Sure.
And then when I understand the whole journey that, the public health,
Hmm.
um, the protocols that have developed over the years to tackle this challenge, how it's evolved,
Yeah.
and how I feel that, the conversation, if we bring back the conversation around this disease, a little more involvement can,
Hmm.
can come about, through
Yeah.
through various means and ways. So
Yeah.
that's a,
Yeah.
lens that I see, like from the past, and how we can um create a little more advocacy and a
Sure.
little more, involvement today.
Sure. Yeah. I suppose, that sort of leads me to the part that I really want to know about more about your tuberculosis project, right? The project that you've been working on in terms of the oral histories of tuberculosis, maybe just how, why, how you got so hooked on to this particular project. From what I've spoken to you about, this is your
Yeah.
current sort of
Yes.
passion
It is. It
space.
is. It is
Yeah.
so
So
weird.
yeah.
And yeah, it is quite weird talking about tuberculosis as a passion project. I mean, people kind of give me a very weird look and say, really, tuberculosis passion project? And they think I'm
True.
a little
These
cuckoo. But
insanity, that's all our personal insanities that drive us.
but
Yeah.
I don't know. Somehow I feel very strongly about the disease now more than ever. Um, I we so the thing to give you a little bit of context about learning about tuberculosis as a medical student. So we have a subject of called preventive and social medicine, which is taught in the third year of MBBS. And that is one subject which is so dry and so not inspiring. And TB has one very important chapter in that book. And for the life of me, I couldn't remember the regimen of the drugs, or, it was not taught to us in the way it should have. And we all, I think even students today would kind of dislike studying PSM, as we called it. But that was the first time that we were taught about the disease TB, and, kind of put it at the back of my head as a bad memory and then never thought about it again. And cut to doing my MD, where as a diagnostician, we were taught to diagnose so many TB cases every week in X-rays, diagnosing TB in the lungs, and in CT scans, diagnosing TB in the abdomen, or if it's an MRI, it could be a TB in the brain. But all of this still didn't, it still didn't kind of uh, make sense, or rather, I didn't understand the depth of the public health challenge that was tuberculosis. And one more thing that I just remembered is when I joined my MBBS college and hospital, we had a separate tuberculosis ward at the time. And it was the first time that I had bought the N95 mask from the chemist. So this was 2008, and we had no idea of how to wear that mask, and we had like one posting in the TB ward before they kind of renovated the hospital, and then changed everything about the ward. But again, nothing landed back then. You thought that, oh, this is it, like it's a very normal thing. And even when doing my MD, we were like, oh, it's TB, like it's a very nonchalant way of dealing with it. I didn't have an idea. Maybe my colleagues or seniors or somebody else may have had an idea of how bad the public health challenge is. In fact, two of my colleagues also had TB, and we landed up, working a little bit extra because they were not able to attend through their course of treatment. And even then, we were like, oh, it's a disease. Like, what's the big deal? That was the thought process that a lot of us had, that what is the big deal? And it just remained like a statistic, or a very regular disease, that people deal with. And cut to a year later, my mom got TB. And and I saw firsthand how, um, how tough just the drug regimen was for patients, the side effects, the long duration of taking the meds. Um, so all of that. And somewhere I thought that, why are we not talking about tuberculosis? Because it's such a big public health problem even today. I had no idea about any of the history, or how long it has been, existing in this world. Nothing of that sort. In fact, I always assumed that TB had a very Indian connotation, that it's a very, you know, disease specific to India, or, um, and then I thought that, and I would try and have conversations with friends, and they're like, yeah, what's the big deal? It's a disease. And I was like, no, we need to talk about it. And I didn't know where to start. So in 2019, I started a page on Instagram called TB Awareness.
Hmm.
And I went down the rabbit hole of wanting to learn about everything to do with TB. And I just found some incredible things about the disease, of how researchers have found tuberculosis in the spines of mummies, which is incredible. Um, and how it was a huge public health challenge in the US
Hmm. Hmm.
and Europe.
Yep. Yep.
Um, Stumbled upon images and cartoons of how the disease was killing more soldiers than the world wars were.
Hmm.
How London and Hamburg, when industrialization happened,
Hmm.
TB was sort of the one disease that was killing a huge chunk of the population.
Yeah.
Um, and how deeply, uh, you know, how TB as this one disease was, called the romantic disease,
Yeah.
and how, you know, it was the cornerstone of the arts, poetry, literature, mm, plays, movies, you name it. They all had the central theme of tuberculosis, and that just blew my mind the more I read about it. And I'm like, I can't believe there was a period of time when everything was all about one disease,
Yep.
and it still exists today. Things like Victorian fashion, like the
Hmm.
way they had corsets,
Hmm.
that changed because the women couldn't breathe when they had TB.
Yeah.
Men's facial hair,
Huh.
the beards were a cornerstone of men's facial appearance.
Huh.
Kind of changed because they're like, it can harbor a lot of bacteria and dust
Hmm.
particles, so then clean shaven.
Hmm.
Something as, yeah,
Styles
and
and
that
change.
is all influenced by
Yeah.
this one disease.
That's
And it's, yeah, so
fascinating. Yeah.
very fascinating.
No, but also when you're saying that there's on one hand you're saying there's a nonchalance with which you deal with it as a medical student, the romance of a disease and how maybe it just permeates many of these
Yeah,
sartorial choices to
yeah,
go the styles and but also poetry, literature, the arts. There's also a stigma associated with TB, right?
a
So
huge stigma, which
yeah.
sadly still exists.
Yeah, so maybe could you tell
People
us a little more
s-
about that, as in, yeah, in terms of, so
about the
when you take up this
stigma,
as a project, as in as something that you're working on, I was
yeah.
wondering if, yeah, you could tell us a little.
Stigma is the biggest challenge, still, you know, in so many ways. Initially, stigma also because we lived in a society which had such rigid caste barriers, especially in a city like Bombay. So that was one. Secondly, historically, it was known to be a poor man's disease. So again, that kind of stigma. And since there was no, um, radical treatment till the drugs arrived, the only other way was to go to a sanatorium and avail of treatment over there. But again, it was known that if one person in the family got the disease, it would spread to the rest of the family. And that's, I think, the genesis, or where the seed of the stigma kind of was, that seed germinated. And it kind of carried on and transformed in different ways. And then people don't like to talk about it. People, till today, if I mention this project to people that I meet, and they're like, oh wow, that's amazing, you're doing a project on TB. Oh, I knew this person. And then I would be like, hey, but if they're interested, would they be open to talking to me about it? And then they're like, I'm not sure, maybe, they've not told a lot of people about it. And a few interviews in, I did get this, that at the time when I didn't have TB, it was just my parents that knew about it. we didn't tell the extended family that this was TB. They might stop coming to our house or something like that. And these are these are stories which have happened in the recent past. It's not 50 or 60 years back. These are quite recent in the last 5 to 10 years. So today also, like I mentioned, that undertone or the undercurrent, I don't want to share that I had this disease, what if? That negative connotation still exists. And that's one of the aims of this project, that just to normalize talking about it and getting people, since it's a closed archive, it's also a way for people to kind of share their stories,
Yeah.
um, you know, in probably a way they would not have done it in the past.
Hmm.
It's a platform for them to kind of voice their story and their emotions, something that they wouldn't have had a chance to do so before.
Sure.
So
So, I mean, also maybe take a moment to plug that for the listeners that if somebody would like to talk about tuberculosis with Nirali, maybe this is, Shared Breath is this oral history project that they may wish to get in touch with, right? Would you like to talk a little more about that? Because I did, mention that in the introduction,
yes,
but would you want to talk a
yes,
little more about this particular oral history project? Yeah.
right. So again, this, I mean, I'll go back to my walk for a little bit, because I kind of feel this is a walk that kind of feels like a gift that keeps on giving.
Right. Yeah.
So the very first walk I did was in December of 2025. And the very, very first walk that I did was when Malvika, Bhatia, and Antara, they attended the walk. And we got talking after, and then we met later. And Malvika and Antara are historians, and they run the Citizens Archive of India. So we got talking, and then TBs, again, like I mentioned, is something that I talk about in my walk. And we somehow, when we were talking about history and the walk and everything, we kept coming back to this conversation, and we're like, why are people not talking about it? It is still a huge problem. The statistics are there. Of course, you have your official WHO figures, and India has this eliminate TB by 2030 goal and all of that. We have these numbers which come in that, you know, Bombay has so many cases and India has so many cases. But somehow that conversation is just, you know, it's just lost. And and in my opinion, I thought that it's a very important conversation that has to, you know, take center stage. And 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 I think it was just a way for like-minded people. And I got lucky because Malvika and Antara also felt so strongly about it. And they were kind enough and so encouraging. And they're like, you know what? Let's just start a project, a oral history project, because we're historians. And that's one thing that we can do, right? We can talk about it and we can get these stories. And the reason why we're documenting these stories is because TB now, the conversations get talked about in numbers and statistics, right? Of course, there are reports which mention the economic loss,
Yeah.
all of that, how
Yeah.
it takes a toll on, toll on the people who get
Yeah.
infected on various levels.
Yes.
But somehow that emotional aspect gets missed, because the disease being so complex, almost every single person's experience will be so different. And there are so many shades to the disease. So we thought that getting these stories would be one way to kind of reignite the conversation around the disease. Like, we didn't want to reinvent the wheel or do something really big or anything. It was just a very small way to start to, kind of bring the attention to this disease to the forefront. So that was just a simple aim through which we kind of started this project. And yeah, so we hope to kind of speak to people across the spectrum who've
Hmm.
had TB, um, patients across all, you
Yeah.
know, across all spectrums of society, doctors, caregivers, nurses,
Hmm.
anybody else, even cancer patients, because they are so immunosuppressed. They may
Hmm.
have
Yeah.
current tuberculosis as well, which makes their treatment so challenging. So there are so many shades of the disease. It
Yeah.
can affect any part of your body
Yeah.
from head to toe, except your hair and nails, right? Because they're dead parts.
Hmm. Yeah.
So yeah, people have such different experiences, and we thought that this would be a good way and a good platform to have, have these stories and take
Yeah.
one step ahead in doing something about this public health challenge.
No, while you were speaking, I was thinking, we should have like this sideline in Sabra, which is that why aren't people talking about this?
Yeah.
Because I feel like this is the question that we keep asking, like when
Yeah.
we're talking amongst ourselves. So
Yes.
Shima and I, we keep sending each other these links, and we're like, why aren't people talking about this?
Yeah.
Why doesn't this get more attention? Like,
Yeah.
why isn't everybody outraged about this?
Yeah.
So I think
Yeah.
it should just be like a standard byline, right? For
Correct.
this work. Like, why aren't people talking about this? So,
Absolutely.
yeah.
Absolutely. No, I also feel that, again, I think I mentioned it to you last time. The times that we are living in, it makes it hard for people to kind of take any proactive action or kind of relate to these kind of challenges.
Hmm.
Thanks to
Yeah,
social media and
you're right. Yeah.
the way we consume content, every second we're bombarded with, grim news from the world over.
Yeah.
In
Yeah.
2020, it's just started like there's been one wave after the other. There have been the fear of some disease or the other, like a couple of months back, or it was Ebola, that we were reading about on the
Yeah.
daily.
Yeah.
Then the war, which has been taking
Yeah.
center stage, and that started with the Russia and Ukraine war a couple of
Yeah.
years back. So, and on the daily, right, everything is so accessible. So there's, one after the other. There's something that's happened. There's something that's happened in India, the
Yeah.
water crisis, the air quality, you name it. And then there's a collective social burnout, in my opinion.
Mm-hmm.
So I keep wondering and I keep asking myself that same question also, that if I had to appeal to a wider
Yeah.
uh, population, how can I, create a wiggle room
Yeah.
for them to give,
Yeah.
some sort of how can, you appeal
Yeah.
to a collective in such a situation, right? That is also this one question that I keep asking myself, that uh if I have to tomorrow um tell people that, hey, please give a damn about tuberculosis, and they'll be like,
Yeah.
sorry, we're already,
Yeah.
we feel it's not that important, it's not going
Yeah.
to affect us, so why should we care?
That's right. Yeah.
um so yeah, that's kind of a little bit of a bubble that we live in,
Hmm.
with respect to the disease, purely speaking,
Yeah.
because it can just come up at any time.
Hmm.
You've inhaled the bacteria because you live in such a crowded city, or a crowded part of India, and you have a great immunity, and the disease there's nothing happening to you, but there may be a situation where your immunity drops drastically,
Yeah.
and you may get a flare up of tuberculosis, who knows?
Yeah.
Or you have your house help,
Hmm.
or your Swiggy guys, or anybody that
Yeah.
you may come in touch with,
Yeah.
the regular,
Hmm.
that you can land up getting the disease even though you're in a small sheltered cocoon in a high rise, or
Hmm.
so it's not as it's not my problem, that kind of a narrative.
Yeah.
uh,
Doesn't
I
apply.
feel should be challenged a little bit,
Sure.
and brought to light as well, that
Yeah.
it's still
It's a
everyone's problem.
for sure.
Yeah,
Yeah.
yeah.
Listening to you, Nirali, I'm thinking we are in such a situation that we have to deal every disease as a separate project. We are almost, you know, I mean, for example, tuberculosis. Similarly, if you look at the cancer, even the COVID pandemic itself treated as a different project, right? So,
Absolutely.
and creating separate awareness for each disease, so it's getting the more complicated. It makes our health system more complicated. And yeah, thanks for the work you're
Yeah.
doing. We need more people like you.
Oh, thank you so much. That's very kind of you to say. But it's just me, really, it's just me being a very giving into my curiosity rather, why and how, and just feeling that even if there's a tiny way that, even through an act which is as simple as talking about it, um, how can you create a little bit of change, right? Like when I said given to my curiosity, when I started posting about tuberculosis in 2019, and I was, just trying to find like Google, I was just trying to Google NGOs
Hmm.
which um dedicatedly worked only for tuberculosis. I couldn't
Okay.
find, and if I was like, okay, I'm a motivated individual, I want to probably donate something to an NGO which only does work in TB, or what is the specific work in TB that they're doing, because the work is also quite vast, right? There's um case finding that you're doing, that you're diagnosing the disease. So
Hmm.
probably doing camps where you're doing x-rays to find cases of TB. So that's one part.
Yeah.
Second part is you're making sure that the patients are getting the nutrition. So government has a program where they're providing nutritional support and a sort of a financial support to
Hmm.
um, patients as well. And then, making sure that they're taking the meds and all
Hmm.
of that. But when I was trying to find, it was all, majority of the work was being done in a very government sector. I found Doctors Without Borders doing a lot of work in TB. I don't know if they're still doing it. Um, there was Alert India, which is again, I think, a non-profit working in TB, but I think it works all over the country and not just particularly in Bombay. So I was looking particularly, I was like, what is Bombay's biggest challenge, right? Because when I now, after reading so much and understanding about the disease, I understand that tuberculosis in Delhi will look different from a public health perspective. Like the the facilities that are available to the patients in Delhi will be different compared
Sure.
to what is happening in Kerala, compared to what is happening in Calcutta.
Sure.
The way the doctors are dealing with it is different. So I was wondering that, with specifically because, Bombay, I live in the city. So I was like, what is happening here? Um, Based on the numbers, Bombay again has the highest number of drug-resistant cases.
Mhm.
So I couldn't identify, like, the information was not so easily available to me. I really had to dig deep, right? What are the challenges when it comes to these TB cases in a public setup like a KM hospital or a Sion hospital? What's happening there? What's happening in the smaller TB dispensaries or other um, public health infra that the government has set up? And where can I, as an individual, fit into this field, right? Where can I help? It should make sense to me. It should be convenient to me also, but I also want to help in some way. So
Yeah.
I'm trying to find an answer to this question, right? Just speaking to people, understanding it um in a deeper way rather. Like it's just that curiosity. I keep asking why and how, and in this context, that where can I make that impact, or where is that one piece which is missing with respect, and that only comes if you kind of none of this information is out there. You have to dig quite deep and, make sense of it in a way which appeals to more people, right? So if by chance you have, more motivated people and they want to be like, okay, I want to do something, where can I start? So that information should be easy to access, right? Can I be a part of the nutrition program? How can I be a part of it? And today, if somebody is willing to financially, contribute to the cause, they also would want to know that, okay, if not a government program, if there is any private NGO which is, undertaking work in TB with respect to Bombay, where can I find, these people, or how can I be a part of it? So these are just questions that I had, and it's just about digging deeper and just asking people these questions. So
Yeah. But just to clarify, that the project itself is a pan-India project, right? The only.
yes, it is. It
Yeah.
is. It is. The shared breath is a
Yeah.
pan-India project. It's not limited to Bombay.
Yeah.
The questions I had were
Yeah,
related
of
to
course.
Bombay.
Grounded.
But we are collecting stories of anybody and everybody who has had TB or is currently going through their journey and would be, happy to share their stories with us. So yeah, so it's just about not seeing the disease through the lens of just statistics.
Statistics, yeah, and data. Yeah.
Yeah, but seeing it through a much broader lens and understanding it.
Great.
All of your projects are connected, you know, even the Fort Walk and this shared breath. So where do you situate these projects within the field of health humanities? So, I mean, according to me, health humanities, it's a study of, health and illness through the lens of humanities, arts, and then, humanistic social sciences. So, how does it different? How can we distinguish it from the traditional medical histories? We have people like authors like David Arnold talk about the medical history that happened in India during the colonial period. Similarly, why it is necessary? I mean, is it? I was thinking, will it be more helpful for us, for you to connect to the people if you do that way? So I'm just curious to know the way you do it. Like, how do you define all these?
So, the way I understand the intersection of the study of humanities and studying medicine and practicing as a doctor, I think it's important for every practicing doctor to understand that medicine is a very evolving branch of science, right? What you thought was the absolute truth 50 years back is being challenged today. And there are still some concepts that are evolving, and we're still learning about it. So nothing is set in stone, right? Of course, it's a huge Western medicine and evidence-based medicine is a very important part of our society and how we deal with our health. But also just going back to the basic definition that health is not just the absence of disease, right? It is so much more. Your mental health and so many other parameters that come into play. Now, when I think about humanities and why I feel humanities is extremely important is because these basic fundamentals, which we've forgotten in the current day, the way we practice medicine now, we've forgotten these fundamentals. And I think humanities is an important way through which we can see the patient and the health of an individual in a more holistic way, or see it in a different light. And the way we practice medicine today doesn't give us the room or the time to take a step back and, truly reflect on these things. And that's why I feel, and to come back to your question, studying the history of medicine, all of that is very important. But how do you practically inculcate that in today's scenario, right? MBBS students from their first, second year, they're constantly studying for their NEET exam, which will happen after they graduate, right? There's no time. Saturday, Sunday, they're going for the tuitions. Okay? They want to crack that exam and get that rank. Okay, now they've introduced, this wasn't there during my time, but now they've introduced ethics and a version of humanities for every subject that you study in MBBS, which is great in my opinion. But I think there is room to consider how it is being taught. Is it just is it just a part of their MCQs that they have to remember and put it down on paper, or is it something that truly inspires a young student, right? Be it research in medicine, or be it something that makes them wonder about the way we practice medicine, or how was it in the past, so things like that, certain gray areas that
Yeah.
exist in medicine, um, the way you are faced with challenging situations in your practice. So is it something that you're studying from a PDF, or are you actually being inspired by the way your teachers are teaching you? That's one question. Um, Coming back to the resident doctors who are pursuing their post-graduation, they are absolutely overburdened. They don't have time to eat and drink food, and on top of that, in an idealistic conversation, you're like, no, study humanities, you study history. No, I'll take you to an art gallery and show you art, and you see art and medicine in a different. It's great. It's happening in the West. It's happening in Europe and UK and all of that. But my question is, how do we bring these really important fundamental um, thinking points to a very unique um, medical education infrastructure in India, right? Um, if you make it a compulsory part of the education, there have to be teachers who can inspire that way of thinking in these students, right? It can't be a didactic 10-page PDF that they learn and, write in their answers, or, it's a part of their MCQs. So, so we need that. It's great that they've introduced that in MBBS. We really didn't have it in our time. So that's one thing. But again, coming back to even the practitioners, once they finish their residency and they're practicing on their own in different hospitals, it's important to kind of take some time out and show them that this is a very different way of thinking, right? You make them ask questions. It can't be a way of education where you're preaching all these things. It has to be something experiential. It has to be in the form of an experience. It has to be um something that makes them think. So this is the way I kind of understand and wish the way medical humanities and the practice of medicine intersects. I'm sure there are answers to this. I personally may not have experienced, you know, as a radiologist, I don't have that kind of exposure. But I'm sure, like, my seniors, a lot of senior doctors in different parts of the country they may have tried to incorporate this in their own hospital or teaching institute or wherever they are. So, but I feel it has to be a cornerstone for
Hmm.
every medical practitioner's journey, you know, at regular intervals to make them, you
Yeah.
know, not just practitioners, anybody who's involved in healthcare, really.
Yeah. Really,
Yeah.
because I mean, it's so many ways to think about it, right? On one hand, it could be it's something that anybody who's interested in the question of healthcare should be thinking of and
Yeah,
asking, right?
yeah,
And just the onus on the doctor on one hand.
absolutely. Yeah,
Of course, so much to resonate with with what you're saying in terms of the physician's training and how thinking with the humanities could be a way of just restructuring medical practice itself, right? Clinical decision making and so
yeah,
on.
absolutely. Absolutely.
But also, I was thinking, because this is coming from a conversation that I had just yesterday with a senior physician who's been working for years in this space, and his question was that why is healthcare something that doesn't mobilize people? In the sense
Yeah,
that
yeah,
it's healthcare is not, and this goes back to your earlier question as well, right?
yeah,
People have so many issues, and then you can't really think of healthcare. Like there's so much to be distracted by,
yeah,
not just social media, but all the events around us in the world. And then is healthcare necessarily in itself a silo that motivates people? And not really was his argument. I'd really like to give him to cite him at this moment, but I just I'll park that till I get consent. But the point being that yeah, I mean, so I guess humanities is one, connecting health humanities is one way to push that conversation, right? And not just make it only something that doctors have to obsess over. I wonder. I mean, I'm just putting it out there for you.
No, but you're absolutely right. And of course, not just doctors, anybody who's remotely associated with healthcare. And now, if you see the present day um, healthcare infrastructure in the country, such a huge onus on private institutions. In the last post-COVID, we've had a huge influx of venture capital funding in huge private hospitals, right?
Yeah.
There's a huge percentage of the population that is going to these places for most of their healthcare needs. And who are running these institutes, who are running these hospitals, right? Even those people could, you know, do better if they kind of had some exposure to medical humanities.
Yeah.
They're making decisions based on spreadsheets and numbers,
Yeah.
but at the end, these are real patients with
Yeah.
real life problems, right? So I find that medical humanities in this context would be so essential, right? The decision makers at the top, they're not dealing with patients on the daily, right? They're not understanding their problems on the daily. So to get them to think a little differently, medical humanities would be a great way, how to uh simple things, just removing them from a hospital context to a museum or an art gallery, showing them a piece of art and making them think a little differently, how you communicate. It's just yeah, very essential in this setting and context is what I feel.
Oh, thank you so much for that. Shaima, did you have any follow-up questions?
No, it's all, we got a lot of things to think now, and
Please,
we'll
but
go through.
I may stand corrected. I may have certain views which might not make sense. It's just me fueling my curiosity and trying to think
Always
about.
learning, right?
No,
I
no,
mean, yeah.
while listening to you, I'm thinking everybody from policymakers to the healthcare worker, even patients and families should involve with this to understand everybody's position, right? If you look at the way, I mean, what is happening in the public hospitals, especially the interaction with the patients and doctors, how bad it can go sometimes. It can kill the doctors, it can kill the patient. So from where we all are coming to understand that. And sorry, I think my internet is
Yeah, I think your
getting
network is
bad.
breaking
Yes,
I'm
now.
it
your
is me.
thoughts
Yeah,
was in for a little bit. But no,
yeah,
you're absolutely
sure.
right. That's such an interesting way to look at it, right? Even from a patient's perspective, they may not know how the facilities are stretched thin in their best to, help them out. But it doesn't come across, and you hear of so many instances of violence against doctors
Yeah.
repeatedly, year after year, so many instances. So, Yeah, and thank you for pointing that out, right? Earlier, when I started understanding about humanities and the medicine perspective, to me it seemed like, okay, probably the physicians, but I guess now after talking to you guys, it feels like a, much more important part of the equation when anybody and everybody can kind of think differently about health in particular
Yep.
if there is some sort of exposure to these experiences.
See, so, I mean, I think you've been generous with your time with us, Nirali. We've spoken so much, but also we'd love to keep talking to you about your project. So, I mean, I'm hoping that we continue to hear from you as the tuberculosis oral history project evolves. So, again, another shout out to those who are listening and watching to, connect with Nirali if they have something to share, but also to follow her on Bombay Vitals on Instagram.
Yes,
And,
thank you.
but also, and hoping that, you will continue to engage with us through Sabra and,
Absolutely. I
you know,
would love to. I
yeah,
would love to. Thank you again for giving me the platform and, inviting me to have this conversation with you. And through this whole process of talking to you guys as well, there's so much that I have also kind of, come to realize it for the first time as well. So it's been great for me. And I will definitely come back, and I would love to have many, many, many more conversations with you.
fantastic. I mean, and that's what we're hoping for, but also most importantly, for those who are visiting Bombay and if Nirali's walk is there, do not miss it
Yes,
because
please. I
that's
would love
quite
to
a,
connect and
yeah,
take you for the walk with me.
yeah, because that's quite a perspective changing walk. So, yes, I hope you get to do more
Sure.
of that and with more frequency for people. I don't know how that works out with you, with everything that you're doing, but I hope, there's the more of these and better weather for Bombay so that
Yes, better weather. I hope so too.
Yeah.
So, thank you, Shaima, and thank you, Devi, again for taking out the time and for speaking to me.
thank you.
Uh,
Thank you, Nirali.
Thank you. Thank you so much. Yeah. Bye bye.
Bye.